Welcome, everybody, and good evening. I remain my humble self, Lucky, Dr. Drugs, and tonight I have the pleasure of presenting a very silent epidemic, in quotes, because of the embarrassing nature of the condition. People don't talk much about it and hence suffer in silence, and that is none other than pile, also known as hemorrhoids. So, talking about pile or hemorrhoids management and treatment. As you can see from this picture here, we can actually have an idea of what we are talking about already. You see the way this person is making use of the restroom and squeezing his face so hard, and obviously you can see that this person is in pain and may not be able to enjoy this natural process. This is the flyer that most of us got, and I remember my humble self, Dr. Drugs, and I'm presenting today this topic, pile, and there is our table of content. Of course, we can't talk about pile without having a brief idea of what the digestive tract, digestive system is about. And then we'll have to define what pile is, talk about its types, signs and symptoms, the red flags to take note of before we know that we have to rush down to the hospital or seek professional advice. Then causes and risk factors, complications. Then we talk about prevention. Then we delve into management and treatment, and we then demystify what chemical intervention really does. Of course, the use of natural pharmaceuticals in management of pile. Now, the digestive tract, just in a very simplified terminology, because we are going to try to demystify and break down certain terminologies so that anybody that listens to this video will be able to understand what we're talking about. Remember, you can always write down your questions. So after this session, you can communicate with whomever sends the link to you or directly to myself if you got this link from me. Now, the digestive tract is also known as the gastrointestinal tract, and it's a long, winding tube. Look at the picture at the bottom right of the screen. You will have a better idea of what it looks like. That extends from the mouth to the exit point called the anus. It's responsible for breaking down food, absorbing nutrients, and eliminating waste products. The digestive tract is divided into several parts, each with a specific function. The mouth, of course, we know that it helps us to chew and makes you saliva. Esophagus transports from the mouth down to the stomach via peristalsis. Then the stomach itself helps us to mix this food mechanically with digestive enzymes to help us break down proteins, fats, and more in a process called churning. And at the end of the day, the results will be what is called chyme, and the chyme enters the small intestine, which is a long thin tube where most nutrient absorption takes place. Enzymes from the pancreas and bile from the liver aid in digestion and absorption. Then we have the large intestine. Let's take very close note of this. The remaining waste products enter the large intestine where water is absorbed and the waste is formed into feces. And the rectum is where the feces is stored until it is time for defecation. But the exit point is called the anus, and that's what we're going to focus on today, because that is where a lot of issues arise as a result of complications in blood vessels around that area. Another important part, or other important parts of the digestive system include the liver, produces bile, the pancreas, as aforementioned, produces enzymes that helps in digestion. The gallbladder stores the bile from the liver. Of course, we have the accessory organs like the teeth, the tongue, the salivary gland, and more. The digestive tract is a complex system that relies on the coordinated effort of many parts to break down food, absorb nutrients, and what? Eliminate waste products. The elimination process may be the hindrance or the point of focus for today, because it may be that there's a problem there that may hinder the smooth transition of this fecal matter out of the body. And that's where we are here today. So by definition, hemorrhoids or pile are vascular structures in the anal canal, but normally they act as cushions that help with stool control. But when they are diseased, they are swollen and inflamed. But guess what? They are still called pile or hemorrhoid. That means even when they are now diseased, the name of the disease is the name of that component or structure or part of the anal organ of the body. And that is why they are still called pile or hemorrhoid. So hemorrhoids are swollen veins in the lower rectum or anus that can cause discomfort, itching, and bleeding. They are a common condition, particularly in adults. In fact, more than half of the people we know will one time or the other in their lives have hemorrhoid pile. So that's why there's actually no need to hide the condition or be embarrassed about it. Talk to someone about it, talk to a professional about it, and seek guidance and solution. You may be shocked that a lot of things we do or we think or we thought were actually the right ways we handle this condition will be shown not to be. So here are the types. We have the internal hemorrhoids. These occur inside the rectum and are usually painless, but may cause bleeding. We'll explain that shortly. We have the external hemorrhoids. These occur under the skin around the anus and can be painful, especially if they become thrombosed or clotted. If you remember in the last video, we spoke about stroke. You see when we talked about the possibility of substances in the blood in collaboration with cholesterol forming what is called clot and block blood flow or cause problems regarding to blood flow, hence killing the brain cells on the other side, leading to what is called an ischemic stroke. But in the anal region, they become thrombosed, aka clotted as well. Now, based on their severity and location, hemorrhoids are also known as piles, are classified into 4 stages or types. The first degree piles is number 1, and these are internal hemorrhoids that just bulge into the anal canal but do not protrude outside the anus. They may cause bleeding but are usually what? Painless. The second degree piles are internal hemorrhoids that protrude outside the anus during bowel movement, but guess what? They return to their original position on their own. The third degree piles are internal hemorrhoids that protrude outside the anus and require a manual pushing to return to their original position. They take note of the fourth degree piles, which are external hemorrhoids that can be thrombosed and cause significant pain, swelling, and inflammation. They cannot be pushed back into place and may require urgent medical attention. If we are to look at what we are talking about closer, you see in this picture here, this is just showing us what we just talked about with regards to the first 3 stages that has to do with the internal pile. And you can see this is the first stage right here, this is the second stage, and this is obviously the third stage. So what are the signs and symptoms? From this picture we're looking at here, we already have an idea what the problem can be here, because this young man is holding his buttocks. His gluteus maximus seems to be on fire as a result of this issue, and the signs and symptoms depend on the pile or the types of pile. Like for instance, internal hemorrhoid pile often results in painless, bright red rectal bleeding when stooling. That means it's painless when stooling and can be accompanied with bright red. Of course, that is blood. You understand? The reason why it's painless is because it's above what is called the pectinate line. Let's just call the pectinate line the River Niger, River Benue. And then anything upwards does not have sensation because the epithelial cells or the covering there do not have nerve innervation. Then the ones that move down south, that anything from the south of that River Niger, River Benue will be having pain. And that is how it is divided. And that is where we begin to talk about external pile. Because they are characterized by pain because they fall below that pectinate line I talked about and sensitive to pain and temperature. And swelling in the anal, swelling in the area of the anus. That means they're characterized by pain and also characterized by swelling in the area of the anus with dark colored rectal bleeding. Now, it is actually possible to have a combination of both. where one can have an internal pile and have an external pile. But there's a challenge sometimes, which is called the skin tag, especially after an external pile has been treated. But bear in mind that about 50 to 66% of people have pile at one point in their lives, and it affects male and female gender equally. It does not gender discriminate. And it's more common among who? The wealthy. So, in other words, pile seems to be more common in the wealthy, and we'll definitely have an idea why shortly. So generally, they include talking about their signs and symptoms. These include bright red blood in stool, also known as hematochezia, or on the toilet paper, that's as often as a result of internal pile, itching or irritation around the anal area, pain or discomfort during bowel movements, especially has to do with the external hemorrhoid or bile, swellings or lumps around the anus, leaky feces. Mucus discharge is often associated with internal piles, feeling of fullness or discomfort in the rectum. Then painful bowel movements, straining during bowel movements, protrusion of a lump or bulge around the anus, that's in case of a prolapsed internal hemorrhoid. Of course, burning sensation, discomfort or pain while sitting, standing, or walking. Frequent bowel movements, this thing is terrible. Imagine that having bowel movements is painful and is causing it to be frequent. Wow. Then we have fecal incontinence. We're talking about inability to control the ability to manage when we are going to go to use the restroom or for number 2 or not. So it can just come out anytime, which could be quite embarrassing. Then constipation or difficulty passing stool. We'll explain how this can exacerbate or worsen pile soon. And of course, anal fissures, which are small tears in the skin of the anus. You know that when that area is having issues and one is having constipation, this can lead to what is called fecal impaction. That means the fecal matter becomes hard and can actually abrade or cause more trauma to that area. And that is what we definitely would not like to have. But oftentimes, in about 40% of cases, there are no symptoms, while others may experience severe comfort. These are then, gentlemen, sorry about this fact that I have to display this picture, but in interest of science, or in the name of science, we have to show people what this thing actually looks like, just in case one is experiencing this and may want to find out if this is truly what it is. So this is what it looks like. This is what, but this looks more like an external pile. But we definitely will not diagnose by ourselves, but make sure we go to a qualified health practitioner to take care of that. So what red flags should we look out for when people are having this condition to know when to start running to the hospital? Severe bleeding, severe pain, fever, discharge of pus, or a foul odor. That means something is terribly going wrong around there. Probably a part of that area is getting rotten. And then difficulty controlling bowel movements, rectal bleeding that does not stop after about 10 to 15 minutes. Now, it is essential to consult a healthcare professional for proper diagnosis and treatment urgently when we notice these things. These are actually red flags. The causes and risk factors include, the causes actually remain basically unknown, but risk factors include increased pressure in lower rectum. You see, upon prolonged sitting, straining, or squatting during bowel movements, it can lead to this challenge. Ascites or pot belly is also a problem because of the weight of that pot belly on that area below it, of which, of course, we know that the anal region is. Then the obesity as well, or excess weight, lifting heavy weights or objects, chronic coughing or sneezing. Sometimes we notice that sometimes some patients notice that when they cough or sneeze, they feel the reports from that area. That shows you how important this information is. Pregnancy leads to an increased blood flow, pressure, and hormonal changes during pregnancy that can lead to changes in the structural integrity of the veins around that area. And of course, delivery as well can lead to what is called pelvic floor dysfunction in about 50% of cases in childbearing women, which could actually complicate this issue or cause this issue, or is a strong risk factor. As people age, there's weakening of the rectal veins and muscles over time, and there's decreased elasticity and tone of the rectal tissue. We're going to talk about this and talk about how we can counter this issue and how it's even related to other parts of our body. Now, poor dieting, like when as in having a low fiber and veggies diet, means that the ability of the fecal matter to imbibe and retain water or fluids, make it soft, is reduced. That is why this can be a problem. Then we talk about spicy food, which can cause increased pressure and irritation. You can imagine some people already having PA, and they can eat so much pepper that after defecating, pepper can begin to grow from that area. That is not good for someone that is having PA because of the irritability that can result as a result of consumption of excess capsicum and pepper. Now, chronic constipation, because prolonged straining during bowel movements can increase pressure on the rectal veins, leading to anal fissure or tear. Sometimes some people are there in the restroom doing number 2, and you think that they are actually in labor. Take it easy. You don't have to squeeze everything all out at the same time, probably because you want to go and watch your favorite movie or something. That can actually lead to injury or tear and cause or exacerbate this issue. Then we have chronic diarrhea. Of course, when the thing is passing through that area too often can cause issues. Of course, irritation and inflammation can result. Lifting heavy weights, as aforementioned, straining when passing stools can increase pressure on rectal veins via prolonged sitting and straining. As you can see, this young lady over here, I don't know whether she's shouting the blood of Jesus or she's shouting for help as she's sitting down here. But obviously, we know that there's a problem because of the way she's squeezing her face. It shows you that this is not an easy task at all. She seems to be as if she's trying to deliver something. Now, family inheritance or genetic predisposition leads to weakened rectal veins or muscles. But let us bear in mind that genetic predisposition is not genetic sentence. That means one can also use appropriate lifestyle changes or choices to ensure that they don't fall victim to this terrible condition. Then we have lifestyle factors. Of course, we just talked about that: prolonged sitting or standing, lack of physical activity, and poor bowel habits. But these factors can lead to increased pressure, inflammation, and irritation of the rectal veins, causing them to become swollen and bulge, as we noticed in that picture that I showed earlier, resulting in or worsening piles or hemorrhoids. Now, refined sugars or carbs help to ensure that one can have this condition via inflammation, high blood cholesterol, which can actually lead to inflammation and clogging up of that area, and one way or the other provoke thrombosed hemorrhoids as well, because insulin resistance and diabetes that are formed, that these have a network of ways they destroy that area. Then we have high blood cholesterol, can lead to hypertension. Remember, talking about pressure on the rectal veins, which can damage it. They talk about poor circulation, because of course, cholesterol, as aforementioned, can lead to that. Delayed healing, excessive cholesterol around that area can lead to delayed healing. Anal fissure will also ensure damage to the rectal veins and provoke blood clots, which cause thrombosed hemorrhoids, which are quite terribly painful. Now, diabetes, as we all know, is a disease of diseases. Of course, hypertension, inflammation, poor circulation, constipation, anal fissures, and a whole lot more. But what they have noted is that diabetic neuropathy can actually lead to a loss of sensation and lead to delays in taking action in regard to hemorrhoid, because the person will not know that there's something going on there. That is one of the terrible things about diabetes. Now, what I'm about to say now is not directed at anybody, but in the interest of science, we have to say this. Anal sex can lead to friction, pressure, trauma, and infection, which ensures damage to rectal veins, causing, and it can also cause constipation or diarrhea and affect normal bowel movement. And all these things are not good in regards to risk factors, being risk factors for this terrible disease condition called bile or hemorrhoid. Sugar and refined carbohydrates consumption, of course, can lead to poor wound healing, just as in the case of diabetes, and also lower immunity. It can cause inflammation, constipation, insulin resistance, of course, diabetes, as aforementioned. So these are a few of the complications. These are just some of the complications that are associated with bile. Anemia is a result of loss of blood. What is called a strangulated hemorrhoid can occur when the blood supply to an internal hemorrhoid is cut off, causing extreme pain. Then we have blood clot, as we have aforementioned. This occurs when a clot forms in a hemorrhoid. This is not dangerous, but can be terribly painful and sometimes need to be drained. We'll talk about that shortly. We'll see it will show us a depiction of what I'm talking about. Then infection of an external hemorrhoid is terrible. And prolapsed internal hemorrhoids are more likely to become infected due to blood flow issues. Last but not the least, here we talk about skin tags, or what I call a tail, which is an excess skin which forms when an external hemorrhoid moves away. So when one is walking, it may seem as if a tiny mouse is dangling or around that anal area, which could be quite discomforting. So how do we prevent piles or hemorrhoid? I'm going to talk about why it's very important we talk about prevention, because of course, prevention is better than cure. Dietary changes. We know we need more fruits, vegetables, and whole grains in our diets. We need to drink more water, an adequate amount of water. We need to avoid spicy and or processed foods. I've explained the reason why we should avoid spicy foods earlier. We need to engage in good bowel habits. That's eating regular meals, which are, of course, balanced diets with lots of veggies and fiber. Avoid prolonged sitting on the toilet, which will help us to reduce pressure on the rectal veins. And we shouldn't strain during bowel movement to avoid tears and pressure in the rectal veins. Lifestyle modifications like exercising will help to improve blood circulation and reduce pressure on the rectal veins. We have to avoid heavy lifting. We have to also take regular breaks to move around and stretch, which will also help to improve blood circulation, reducing pressure around the rectal veins. Of course, good hygiene is very important because keeping the anal area clean and dry reduces irritation and inflammation and prevents infection. And of course, we have to avoid scratching or rubbing the area, which can, in order to help us avoid infections and damage to rectal veins. We need to also avoid prolonged sitting and standing. We have to lose weight. Of course, you can go to YouTube and watch the video that I have made with regards to lifestyle modification, weight loss, and detox. That will explain better. Avoid smoking, because smoking can lead to constipation, which will lead to further strain and pressure on the rectal veins. Smoking can also damage blood vessels. We know we're talking about a condition that has a very strong link to blood vessels. Then smoking can lead to free radicals that damage DNA of the cells of the blood vessels around that area. Then we have to manage chronic conditions like irritable bowel syndrome, constipation, and diarrhea. Then we have to avoid heavy alcohol consumption because alcohol is a diuretic agent and encourages the exit of water from the system and can dehydrate the system and lead to constipation and fecal impaction that can further lead to trauma and straining of the rectal veins. Then practicing good bowel habits or movements, that's taking time to pass through, as aforementioned, and avoid homosexuality or anal sex, because this can damage the rectal veins as it is like fitting a square peg in a round hole. It doesn't even make any scientific sense in the first place. So it's advisable to stop that completely and do the right thing. So how do we diagnose this condition? Just to mention a few. Of course, visual examination, you can actually see an external hemorrhoid, and okay, it's just like the picture we saw last time. Anoscopy involves inserting a hollow tube device with a light attached at the end so we can see and examine internal hemorrhoids and all that. And also, we can also use what is called the digital rectal exam to rule out other possible conditions like maybe prostate issues, rectal polyps, abscesses, and all that. And of course, the symptoms are also important amongst others. So how do we manage and or treat PAM? Yes, this is a very important aspect. So pile or hemorrhoids can be treated in several ways depending on the severity of the condition. Here are some common treatment options. Now, we're not saying that this is exactly what will happen. Your health practitioner or your healthcare giver will definitely tell you the best approach to use. So this is just like I'm trying to show an example or some examples of what we do with regards to situations or health conditions like this. Now, of course, lifestyle changes, as aforementioned, just avoid the risk factors. That is very, very important. Then we need over-the-counter medication like creams or suppositories to help with the itching and inflammation. Pain relievers like acetaminophen, that's paracetamol, may be, which can even be as in form of suppository or ibuprofen and all that. Stool softeners can also help to reduce straining. Then we have prescription medications, some topical creams or ointments that contain hydrocortisone and other steroids. We have oral medications like metronidazole, sulfasalazine, loans, and all that. Then we have non-surgical procedures. For instance, a rubber band ligation. A rubber band is placed around the hemorrhoid to cut off blood supply. We have sclerotherapy. A solution can be injected into the hemorrhoid to help shrink it. If you look at this picture here, you can see this hemorrhoid that has been injected and eventually is now cool, calm, and sleeping and shrunk. That is what we're talking about. Of course, infrared coagulation, which is special, of which a special light is used to shrink the hemorrhoid. There are a lot of things that can be done depending on how your health practitioner or healthcare giver is what he or she desires. Of course, surgical procedures, which include hemorrhoidectomy, that's hemorrhoidectomy, surgical removal of the hemorrhoids, and of course, stapled hemorrhoidopexy or hemorrhoidopexy, sorry about that, a surgical procedure that staples the hemorrhoid in place. And then we have natural remedies, which include aloe vera gel, which help to soothe and reduce itching and inflammation. Can you imagine that? Then we have warm bath or sit bath, which soothe and relax the area. Please bear in mind that we're not supposed to do this for more than 5, 10, 15 minutes at a time. Then we have the use of ice packs or cold compress to reduce swelling. And then management of other predisposing health conditions, diabetes, tension, obesity, and high blood cholesterol, and more. Then we have therapy, for instance, or an example, cognitive behavioral therapy for anal sex addicts and gay men to help to deter them or hinder them from having that or reduce that desire to destroy other people's anal area. Of course, as we said, does not make scientific sense or moral sense to do that. Then we have natural pharmaceuticals, which don't have side effects and often give excellent results. We're going to focus on that, and we're going to focus a bit more on the chemical intervention or the use of prescription drugs or chemical drugs as well. So what are the challenges in the management of treatment of PAL? Late treatment due to embarrassment or shame. And of course, poor health infrastructure, fake drugs, self-medication, old habits die hard. Telling people you have to stop eating dry bread all the time. You need to take all that thing. A person like, I have been eating this bread for the past 200 years and they're not going to stop. And of course, that person is already signing a consent form to have PAL in the future. Then we have economic challenges as well amongst the host. So let's talk about chemical intervention. So examples of drugs often used. I'm not talking about drugs that you must use. Remember to always consult with your trained health care provider or health practitioner that attends to you. Do not do this on your own. Now we have corticosteroids like hydrocortisone. Of course, they reduce inflammation and swelling and relieve itching and discomfort. Analgesics like lidocaine and paracetamol or acetaminophen also help to provide pain relief and help manage discomfort and itching. Then we have anti-inflammatory drugs like ibuprofen and aspirin, do the same thing. Laxatives help to soften stool like the bisacodil. and promotes regular bowel movement, reducing straining during defecation, which can exacerbate or worsen piles. We have the venotonic or phlebotonic agents like the flavonoids, calcium dubecilate. Then there's this popular two that are called diosmin and hesperidine. I'll tell us something about that shortly, which improve blood flow and reduce inflammation and strengthen these blood vessels and reduce what incidence of bleeding. Then we have the anesthetics that help to numb the affected area, providing temporary pain relief. Bear in mind that a lot of these things have temporary attached to them. And we'll talk about that why shortly. Then we have the topical creams or ointments with active ingredients related to the aforementioned. So they help to soothe and protect the affected area, reduce itching, inflammation, as well as discomfort. Now, let's take very close note of this because this part is very important. And this is the reason why a lot of people are having what is called management madness, which is doing the same thing over and over again and expecting a different result. These medications can help alleviate symptoms such as bleeding, pain, itching, discomfort, swelling, inflammation, etc. However, it is important to note that these medications may not shrink the hemorrhoids themselves, but just rather help manage the symptoms temporarily. And the side effects associated with them may not be too helpful. So using these things repeatedly without having adequate lifestyle changes or doing the necessary things or the needful is a complete waste of time, because once the half-life of the drug is over, the problem that it helps to mitigate will begin to come back. That is one of the challenges with these chemical drugs. And of course, the side effects may not be too helpful. Many of us don't even bother to go and read to know what are the side effects of these things that are being taken. And we see that it's as if it's giving one side, taking away. So we have to be careful. So a typical example is that steroids are implicated in thinning of the skin when used for prolonged periods. Hence, must not be used for more than 14 days. But some people have been rubbing steroids from January till now. They have not stopped. You can see what I'm talking about. Of course, natural pharmaceuticals are hence indicated and unneeded in collaboration with appropriate lifestyle changes, which, of course, gives a better guaranteed, or do I say gives a more guaranteed healing or resolution of this matter. Either of the two. Now, a popular example includes diosmin and hesperidine supplements, which we often know as Daflon. A lot of us do not even know that when you're taking Daflon, you think it's a chemical drug, but the active ingredients there are actually from orange peels. I'm not saying we should go and collect orange peels from the goats in the village. I'm just saying that this diosmin and hesperidine, which are the active ingredients in Daflon, are supplements. That is why it's very important you discuss with this hair practitioner that is a scientist as well, who will be able to differentiate or throw more light into what we're talking about, because there's a very thin line between natural pharmaceuticals and chemical ones. So, we've talked about how important natural pharmaceuticals are in collaboration with lifestyle diseases. In collaboration with good lifestyle choices or changes. Now, let's just go a bit deeper and see what we're talking about. Because, of course, we already know about these chemical drugs. A lot of people have been using them. But some of us are completely oblivious that nature has provided a lot of things for us. And these things have been standardized and placed in very wonderful packages to help us get better. I keep coming to things like this because I have seen, tested, and used for my patients. And these things work wonderfully well, especially when used properly. Now, they help against pain and inflammation, attack free radicals with powerful antioxidants that damage DNA of cells, because those free radicals damage DNA of cells, so the antioxidants help to counter them. They help to repair damaged anal tissue via what? Somatic stem cell stimulation. I've explained before that stem cell, swallowing of stem cell, or putting under the tongue and all that are mostly untrue. We don't know about the future, but for now, they are all fake. because we can only stimulate somatic stem cell stimulation, which are the stem cells that are mostly available after childbirth or delivery, after we are born. Then the pluripotent stem cells are the ones that work or are very active during the early stage of fetal development. We're talking about from the early stage where after fertilization, embryo and all that, they have to differentiate into all the organs. But you can find some somatic stem cells in the bone marrow, which differentiate into blood components. So let's take note of this. You hear people saying that they are swallowing stem cell. Hydrochloric acid will destroy any stem cell. Together with pepsinogen converted by the hydrochloric acid to pepsin will help to finish up the work. And then if you put it under the tongue, cells will not pass through cells because the layer under the tongue is also made up of cells. So I stand to be corrected. If you know anyone that feels that I'm not saying the right thing, please give the person my phone number so that I too can learn. Now, hydration and lubrication is very important, which these natural pharmaceuticals can help to provide. They have to tackle bleeding and improve blood flow and resolve what? Anemia. Then they help to support healthy digestion, prevent and resolve constipation and fecal impaction by softening the stool. And they support the immune function, prevent and resolve infections, manage lifestyle diseases like high blood cholesterol, diabetes, obesity, hypertension that can actually exacerbate this condition. They help to soothe the digestive tract, boost collagen, which is very essential for what? Tissue support and integrity. Talk about that shortly. I'll tell us some things about this. And then they have to provide probiotics and prebiotics for good gut health via improved gut microbiome and reduce inflammation. Isn't that wonderful? And more. So let's just take this one at a time. I'm not saying that this is what you must use, but this is what I use for my patients, and I'm having wonderful results. So we're going to talk about these things, but what we should be focusing on more are the active ingredients that are embedded in these things. The tiny miracles that God has embedded in these things, active ingredients, are what we should be focusing on. Now, Forever Fiber contains a unique blend of natural fibers, gums, and more, and they help to what? Soften stool, promote regular bowel movement, lower blood cholesterol because they have soluble fiber as well, then provide prebiotics that support the growth of beneficial gut bacteria and soothe the digestive tract, reducing what? Inflammation and discomfort, which are consequences rather of time. Anytime I come to this product, I really like to just move fast because it has so many functions. The functions are numerously numerous. So let's just bring out the ones that are more important and are strongly related with what we're talking about. Now, it has more than 200 helpful compounds and is also known as nature's wonder plant. But just to mention a few, it has acemaman, glucomaman, anthraquinones, powerful antioxidant, etc. that help to soften stool. We know what that does. And it also helps to lubricate the digestive tract to help feces pass without much stress, reducing pressure on the rectal veins. Of course, the anthraquinones will help with the analgesic and anti-inflammatory qualities. They help to tackle other lifestyle diseases and conditions that can exacerbate or worsen this condition. They help to fight bacteria because it also contains antimicrobial capacity and helps to regenerate and rejuvenate damaged anal tissue and blood vessels via somatic stem cell stimulation. Isn't that wonderful? What are we looking for when we're talking about damage of the blood vessels leading to this problem? And we have something that can reverse it. So there we have it. Then it also promotes collagen production for healthier, more stable rectal tissue. The same collagen that helps to hold the skin of our lovely ladies in place to make it supple and smooth is also in our knee joints and other joints in the bodies, of course, and guess where again? Also in the anal region. That is just it. Because remember, that area needs to have structural integrity. And I've come to realize that God is a very wonderful designer. He uses the same material when it is needed. If you look at a case of lumbosacral spondylosis or lumbar spondylosis, you find out that the annulus fibrosus, which is the padding between the intervertebral bones, is made up of about more than 70% collagen because of what? Structural integrity. That's why collagen is very important. We'll get to that very shortly. Of course, we have Lycium Plus. Now, Lycium Plus contains a unique blend of ingredients, of course, that include Lycium barbarium, amongst others, which help in anti-inflammatory properties, help to reduce swelling and inflammation, protect DNA because they have powerful antioxidant properties, boost immune function, improve blood flow and circulation, reducing pressure on the rectal veins, and support what? Collagen production. There you go again. For healthy what? Anal tissue. Of course, they help to reduce constipation and ease bowel movement. So that's Lycium Plus. That's what it looks like. Garlic thyme is unique in the sense that it has the ability to shrink hemorrhoids. So it contains a lot of materials or ingredients ranging from Allium sativum, Thymus vulgaris, lecithin. Let's take note of lecithin because we talked about this when we're talking about treatment or reversal of hypertension. Now, these, amongst others, help to reduce the size of hemorrhoids, relieve itching, burning, and discomfort, support healthy digestion and bowel movement. Of course, you know the implication of that. That will ease off the strain around that area on the rectal veins. Then reduce inflammation, pain, and swelling, prevent and fight infection, promote healing. Of course, thymol is also here. Then improve blood flow and circulation, reducing pressure in the rectal veins, soothe the digestive tract, support immune function, protect cell DNA, reduce cholesterol via lecithin and associated complications, especially in thrombosed hemorrhoids. Then reduce cholesterol blockage, leading to better blood circulation, reduce peripheral resistance. Remember when we talked about this in the time when we talked about management and reversal of hypertension, and hence lower blood pressure, reducing what? Pressure in the rectal veins. This product is very unique because for something that is purely natural, the capacity to destroy microorganisms is wonderful. So it contains ingredients from the beehive, which include propolis and more, and helps with what? Helps reduce inflammation, swelling, and pain via its anti-inflammatory properties. Support immune function and overall health. Fight and prevent infection, especially because of its antimicrobial, remember, antibacterial, antiviral, and antifungal qualities. That's the antimicrobial effects and promotes healing. It improves circulation and reduces pressure on the rectal veins, soothe and calm the affected area. Of course, it has antioxidants that protect DNA from damage. Here is the cream of what we're talking about. And of course, it has the ability to reduce inflammation. Apply this directly and see wonders. In fact, I have a patient that applied this thing twice or thrice, and this pile of the thing disappeared. Most likely it was a stage 1 pile. And the guy was just so grateful to God. Then they have to prevent and fight infection. You know, that area can get messy. You know what passes through that area. And you know that a lot of microorganisms accompany what passes through that area. So what do you think will happen when there's a tear or the blood vessels are rupturing over there and expose the body to those things and those microorganisms that are passing and accompanying or escorting the material that passes that area? So you see why it's important we have this material. And of course, you can't be swallowing antibiotics 24/7. You know that they have side effects. So why don't you go back to nature and help yourself and help your ministry to move forward? Now, they soothe and calm the affected area, support skin health and collagen production. There you go again. Collagen is here again. That maintains structural integrity of the anal region. And of course, help against what? Itching and discomfort. Then we have super greens, which contains alfalfa, spirulina, and a lot of other things that help to regulate bowel movement, reduce inflammation and pain, soothe and calm the affected area. Of course, provide essential nutrients and antioxidants that protect DNA, support immune function and overall health, and provide prebiotics that promote the synthesis of what? Vitamin K2. Can you imagine? And in fact, vitamin K and its analog vitamin K2, which on the other side is very useful for people that are having osteoarthritis, because it will help to translocate calcium from the tissue back to the bones and joints to help to relieve such issues. Is that not wonderful? Of course, let's look at its cousin, which also contains a lot of things, including fiber-rich ingredients that help to soften stool, reduce swelling and inflammation and pain, protect against cell DNA damage, calm and soothe the affected area, boost immune function, also provide prebiotic that leads to what? Vitamin K production. Against bleeding. There's something that, there's actually vitamin K injection that are given to people that are having severe epistaxis, that's the bleeding from the nose, as a result of rupture of those tiny blood vessels in there. So you can see that vitamin K is very important. And even when people are having severe menorrhagia, is one of the things that are indicated with regards to that. That's excessive bleeding, especially excessive bleeding in women, and a lot of that just on the side. And then, of course, healing of damaged tissue via adaptogenic ingredient. And of course, they help to boost immunity. We have B12 plus because they contain cobalamin analogs and folate analog and all that. Let us bear in mind that these cobalamin and folate analogs help in what? Red blood cell production. And that is why in cases where we have megaloblastic anemia, which is as a result of shortage of DNA materials or materials to produce DNA, you see that the red blood cells begin to become enlarged without splitting, leading to large cells, red blood cells. And that is why it's called megaloblastic anemia. You see that this will provide the necessary materials for DNA production, hence the cells split at the appropriate time, helping to reverse this kind of anemia. So you can see that this will help with regards to boosting blood production. Then we have infinite Fermin complex. Ladies and gentlemen in the Lord, you can see that this is raw collagen. And we've been talking about collagen and our God Almighty always making sure that the essential material for structural integrity is there when it is needed. And collagen is among the first things that you should look out for when you're looking for structural integrity. Now, raw collagen helps to maintain and recover the structural integrity of the damaged anal region. That is what, in short, that is what it helps you. So you see how important it is. We have Active Pro B, which provides high-grade probiotics that help boost immunity, reduce inflammation, and encourage good gut health via improved microbiome. Now, these microorganisms, which include Lactobacillus acidophilus and more, as well as Bifidobacterium species, also help to compete actively against bad bacteria. And you know, bad bacteria can lead to inflammation and other issues. Bear in mind that Helicobacter pylori that causes peptic ulcer disease is a bad guy. He is a bad boy and is a bad bacteria. And this Active Pro B is very, 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 very useful against it. Of course, Immune Blend, from the name alone, you will understand what it does, because you have to boost the immune system to make sure that those areas that are being affected and are being messy as a result of the condition will have immune support to make sure that bacteria do not cause infection or other microorganisms in that area. And that's one way this is achieved is by increasing the quality and quantity of white blood cells, our foot soldiers in our bodies that prevent problems from outside sources. And that is why this is very, very important in this regimen. And then we have Actic C. This Actic C, remember, is so when we're talking about hypertension, reversal and management, we mentioned that Actic C helps to disperse cholesterol aggregates. And guess what? It also helps to disperse thrombosed hemorrhoids. That is also why it's indicated alongside the garlic thyme that contains lecithin. Now, these are just a few of these things, and it doesn't mean you must get everything that you see here. This will be based on the discretion of your health practitioner and or health practitioner that is also a scientist. And so there are many others indicated in different situations related to pile or hemorrhoid, but these are just to mention. So let's kindly remember not to adjust medication and doses without the guidance of a trained health practitioner. Sabinus, please take note that it is not done that way, because it can lead to complications and, of course, make things worse. So a trained health practitioner must be by your side, in front of you, behind you, top, above and below, to guide you and make sure that you don't make mistakes via self-medication. So let's remember that we are what we consume, And there is a constant battle between factors that repair and protect our bodies and those that break it down. So all we need to do is to be inside. So with that, I leave you with this. Thank you for coming. Remain blessed. At this point in time, I will say good night and God bless. Bye.